Good day, everyone. Sharing with you the outcomes of our persistence and motivations in making this study possible. Presenting the enhancing patient navigation and referral through a tele-referral system with Geographical Information System for Southern Isabela Medical Center. Yours truly, Winston Domingo, together with me, my co-authors, VIRDI Gonzales and Jennifer A. Gamay. One of the programs of the current administration is the digitalizations on the vital services of the government, including healthcare services. Healthcare systems have faced increasing challenge in ensuring timely and efficient patient referrals between healthcare providers. It was mandated by the Department of Health through the Universal Health Care Act to ensure that the patients are navigated properly to access the appropriate care at the appropriate time and the health facility. Healthcare is one of the government's 8-point socio-economic agenda of the Philippine Development Plan for 2023-2028. The patient tele-referral system is a novel approach that integrates geographical information system technology, aims to computerize the patient navigation and referral process in the hospital. Most specifically, it seeks to investigate the implementation, its impact, and effectiveness in the healthcare domain. The integration of GIS technology and tele-referral systems provides valuable insights into geographical healthcare disparities and aids optimizing resources allocation. Typically, on the hierarchy of healthcare referral system, cases are made or are referred from the primary or community healthcare unit to the next higher level facility, which is the secondary level or district hospitals. Unresolved cases in district hospitals are transferred to tertiary institutions such as provincial hospitals and medical centers. But there are challenges that come across in patient referral and navigation, such as there are healthcare facilities that have but no available medical experts, no available rooms for inpatient care, and no up-to-date medical facilities for hospital operations. And for the objectives of the study, the problems and issues in patient and what are the problems and issues in patient navigation and referral? To develop a computerized system, comply with the guidelines and legal basis. And to develop a tele-referral system with geographical information system to assess the level of compliance as assessed by the IT experts and to assess the level of acceptance as assessed by the end users, and to determine the significant differences on the perceptions of the IT experts and the end users on the level of acceptance of the system. And for the hypothesis that there is no significant differences in the perceptions of the IT experts and the end users on the level of acceptance of the developed and computerized system. For the methodology, in order to achieve these objectives, this study made use of the research and development for the developed computerized system. The principles and methodologies of the prototyping model called the Agile Development Method were used in this research. Furthermore, a descriptive survey study with a validated survey questionnaires patterned to the ISO 25010 software quality standards was used to utilized by the researchers for the collection of the respondents' perspectives and experience in using the computerized system. The respondents of the study are the 5 IT experts and 30 healthcare providers. Moreover, descriptive statistics was employed to obtain the general weighted average on the level of compliance and acceptance of the developed computerized systems, while the Mann-Whitney U-test is utilized to compare the significance of results on the assessment of the respondents on the level of compliance and acceptance. For the research findings, with this, let me now start discussing the findings of this study. A common and persistent problem in patient navigation and referral system was ineffective or insufficient coordination and communications between healthcare professionals and patients, which can lead to various challenges and issues such as delayed or missed referral, poor follow-up, limited access to specialists, resource constraints, lost patient information, fragmented care, lack of patient engagement, communication barriers, data privacy, and security concerns. On the contrary, educating both healthcare providers and patients about the importance of referrals and follow-up care can contribute to better outcomes. While on this initial implementation, the tele-referral system with GIS was activated through an internal website. The developed computerized system would help the healthcare facility in managing patient referral and navigation. Most specifically, it strengthens the following features. Online patient referral and navigation, data collection and record patient information, patient referral tracking and monitoring, assigning of receiving physicians to referred patient, tracking of ambulance location and movement, the real-time dashboard of the system, the heat map census, and for the findings to the research objective number 3, the following are the different guidelines and legal basis mandated by the Department of Health in strengthening the patient navigation and referral system. This is also as the evidence or the reference of the researchers in constructing the tele-referral system with GIS. The RA 11494, the Bayanihan to Recover as One Act. The DO 2020-0653, the creation of one hospital command or the OHACS. Then we also have the guidelines and basis and mandated by the DOH, the Republic Act 11223 or the Universal Health Care Law. And we also have the AO 2020-0019, the Service Delivery Design of Healthcare Provider Networks. And we also have the DepEd Order 2022-0210, strengthening of the patient navigation and referral system or the NPNRS. Now I'm going to present to you the results of the research objective number 4 and 5. The assessment of the tele-referral system with GIS revealed that on the level of compliance as assessed by the IT experts, the respondents strongly believe that the highly developed computerized system is highly compliant or was highly compliant to the ISO 25010, obtaining a grand mean of 3.60 with a standard deviation of 0.192. And on the other hand, the level of acceptance of tele-referral system with GIS as assessed by the end users, the respondents highly accepted the developed computerized system, obtaining a grand mean of 3.53 with standard deviation of 0.195. This only means that the two different groups of respondents rated the tele-referral system with GIS got a positive responses across all software quality characteristics indicated in ISO 25010. Moving to the statistical analysis of the study, using the Mann-Whitney U-test, a non-parametric test equivalent to the parametric t-test, the results obtained of the assessment of level of acceptance by the 30 end users is compared to the assessment of level of compliance by the 5 IT experts to see the differences of the two different groups. The Z score of the two different groups is computed as 0.849 with a significance value of 0.396 at 0.5 level. This means that we failed to reject the null hypothesis. Therefore, this implies that the extent to which the IT experts assess the compliance of the tele-referral system with GIS does not differ with how the end users assess its acceptance. Moreover, both users receive highly favorable ratings. And for the conclusions, tele-referral systems with GIS hold significant promises for improving healthcare's access, efficiency, and patient satisfaction. With this, that integration of GIS technology into tele-referral systems can optimize care coordination and resource allocations, ultimately leading to improve the patient outcomes. The developed computerized system was aligned with the guidelines and policies mandated by the Department of Health, which was really beneficial for Southern Isabela Medical Centers, not only with the healthcare workers and patient navigators, but also to its clientele. And for the recommendation, the expanded implementation of tele-referral systems to the other healthcare facilities was recommended to optimize the meaningful goal of digitalization in the healthcare system. Furthermore, the development and collaboration between the healthcare institutions, policy and technology developers, as well as provisions of government support to realize the full implementation of this innovative approach in healthcare system. The developed systems were already being used by the SIMC. Also, it has already a MOA between SIMC and the City Health Office of Santiago. To use the said system for the future development plan, the system will work interoperability with the inter-hospital within the Cagayan Valley. And to meet the SDG 9 and SDG 11 for the health sector in the region. So that's all. Thank you and agyaman kami.